Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon, and I see hundreds of patients every single week with back pain and neck pain. In this video, I'm going to talk about back pain myths. Patients are often worried that they're going to be paralyzed one day. And that might be because their family member told them that, or maybe even another doctor told them that. And I will tell you, in the vast majority of patients, now I will say there's a select specific indication where that is a relevant discussion. But for the vast majority of patients, especially where there's no neurologic compression, the chance of someone being paralyzed from an arthritic condition in the low back, for example, is exceedingly low. I don't want to say it's impossible, but it is exceedingly low. And the chance that someone could be paralyzed, even if there is neurologic compression, typically when patients have arthritis, that arthritis happens over time. It's not really sudden. And so our bodies are accustomed to withstand that compression over time. And while it can provoke pain, the chance that that leads to someone being paralyzed is just extraordinarily uncommon. And the second question, that you're going to end up in a wheelchair, that is also a fear that a lot of patients have and that they think might happen. And again, this is coming back from maybe a family member said it to them, or maybe they had another doctor say it to them. That also, in line with being paralyzed, is very, very uncommon. Now, we do know that as patients get older, patients tend to lose functional status for a variety of reasons. And so there are reasons why people can potentially end up in a wheelchair later on in their life, but that's very rarely due to any neurologic compromise per se from the spine. That is another great myth that I hear a lot. A lot of patients say to me, well, I didn't want to go to the gym because I was experiencing back pain, or I didn't want to go to my yoga class. We actually know, and this is based on good evidence from the American Academy of Orthopedic Surgeons, from the American Academy of Family Practice Doctors. We know that if you're experiencing an acute exacerbation of what's otherwise chronic back pain, we know that going and staying active, going to the gym, going to the mall, maintaining your activities, avoiding bed rest is the best thing that you can do to make your recovery from that acute episode much faster. That's another very, very common question I get asked. So another common situation is that a patient comes in with an MRI, and keep in mind, MRIs are they're written by radiologists, MRI reports, and they're not written for the layperson. They're written for other medical providers. And those MRI reports can have a lot of scary words if you don't know what they mean. They can say facet arthropathy, they can say stenosis, they can say disc herniation. The reality is a lot of these words, at least the ones I mentioned, tend to be part of the arthritic spectrum. And so they can cause symptoms. I don't want to say that they're completely benign, but they're almost definitely not catastrophic. There are a lot of scary words. And so my job as the surgeon who's actually interfacing with the patient is to take what that radiologist said and digest it into something that is interpretable, number one, but more importantly, clinically relevant. In other words, are those findings, do I think as a spine care provider, are those MRI findings actually what's causing the symptoms? Because keep in mind, if I took an MRI on 100 people who were over the age of 50, I would probably find something wrong in all of them. So this is actually a great question that we as spine care providers don't know the answer to. There are lots of structures in the spine. There are muscles, there are ligaments, there are joints, there are bones, there are nerves. All of these things can be pain generators. And sometimes it's really obvious in a patient what that pain generator is. And some of that comes also from experience, from seeing a lot of patients with back pain. But sometimes, and actually more commonly than not, It is not obvious what the source of pain is. And a patient might have disc degeneration, they might have facet arthritis, they might have some myofascial tightness, and I have no magic way to know, is it that disc that's causing the pain? And keep in mind, there's also multiple discs, not just one disc. Or is it that facet joint? And again, there are multiple facet joints, not just one facet joint. And so one day in the future, I will be able to say to a patient, it is that facet joint that is causing the pain. And when that day comes, I think it'll be a real advancement for spine care. But right now, we're just not there yet. So it's really common to see some structural imaging finding that's not necessarily 100% normal. And in those patients, it doesn't necessarily mean that that's the pain generator. And so it really does take some trial and error in working with your doctor to try and figure out what is causing the pain.